So if this is a cell membrane here, and we have got billions of them in our body, the more injuries that we have to our bodies, and this can be things like, again, chemical exposures, will poke holes in the cell membrane, as will a million other things that stress our body. So we've got voltage here, and we've got mitochondria. They make energy in our cells. So we want lots of energy. Most of us, we don't have as much as we'd like. And so the more holes we get poked in the wall of the membrane, or I always talk about a castle wall, we're losing electrons, losing voltage. When you go under the air pressure environment, you're compressing oxygen, nitrogen, and argon. They act like buckyballs to fill in the hole in the wall. It's like holes in the dike that are being plugged. And so when those are in, you are gaining voltage. It's like putting more insulation. If you've got an electrical wire that's misfiring, we want more insulation on it. And so this is what happens. You're increasing insulation, it's holding on to more voltage. If the body has more energy, then it can do more to heal itself. And so that's a big factor, voltage. Two, as I talked about, was the 19,000 different genes that are turned on, anti-inflammatory genes. And then third, there's about 5 or 6 other amazing things that happen. Stem cells are stimulated. You create more blood vessels, or what's called angiogenesis. You get glutathione increases. So glutathione is the great antioxidant in the body. And what that will do is, it's like calling the fire department as well. It will pull out heavy metals. I didn't talk about that as being a toxin. We all have heavy metal exposure over a lifetime. So that's going to go into the cell and pull out heavy metals when you do hyperbaric therapy. Mitochondria, when I mentioned that, the cool thing with hyperbarics, mitochondria, we increase the number of mitochondria. So if you think of, most of us have had COVID, and that being an example, the mitochondria will get injured during COVID. So that's why a lot of folks have this chronic fatigue, brain fog, amongst many other reasons. So if you've got damaged mitochondria with COVID, how can you, and this is why we've had so much success with hyperbaric therapy for COVID injury, COVID long haul, COVID vaccine injury, is it is actually telling the body for the horses, the mitochondrial horses that are injured, to drop out. They literally fall out. And when you do more of the hyperbaric therapy, it's replicating or making more of the mitochondria. So you're making more of the ones that are in good condition, the ones that are in marathon shape. The ones that are injured, those ones are dropping out of the race. So you're left with a lot more of the good things that make energy as a result of hyperbaric therapy.